hospital, you know that we would have been, or we are occupying temporary accommodation for more than 20 plus years. So we are indeed very happy that we are at the stage where the architectural consultants have been able to design, through consultation with us here on Montserrat and other appropriate agencies, to present to us the detailed designs. This is an information session where the consulting firm, Article 25, will be presenting to you what the new hospital will look like. There will be an opportunity at the end for questions, and I'm sure, of course, you would want to know when the new hospital will be built, or that information will be presented to you in the consultation. But seeing that you didn't really come to hear me, I'll pass over to Article 25, represented by Branca and Joe, and they will make the presentation to you beginning now.
Thank you very much, and good evening, everyone. I am Branca. I'm a senior architect at Article 25. I'm here with my colleague, Joe. And let's have a look at the hospital. So you probably have seen this model downstairs. So it's a model of how the hospital is going to look like. Before we go into a few more images, I'm going to talk to you a bit about how we got to where we are in terms of the project. So the hospital is about 57,000 square feet of healthcare provided in 3 floors. We have 25 beds in a mix of wards and individual rooms. There's a dedicated acute mental health room. 2 operating theaters, including endoscopy, full diagnostic suite, CT scanner, X-ray, mammogram, ultrasound. It's a fully accessible building. It has 2 lifts. It's hurricane and earthquake resilient. It's a fully air-conditioned building with mechanical ventilation, which will ensure that relative humidity inside is reduced, so this will create a more pleasant environment and also will make sure that the hospital lasts longer. And lastly, there are 70 car parking spaces, including 5 parking spaces for wheelchair users. So over the past several months, we've worked with quite a lot of people to make sure that we got where we are now. So these are some of the stakeholders we met: the government, the Ministry of Health, the hospital staff themselves. We met pretty much everyone that works at the hospital. The Public Works Department, the physical planning, the emergency services, to make sure that the buildings meet all the regulations and that are suitable for Montserrat. And also we had community engagement, and we had consultation with some UK bodies, including the FCDO and the NHS. So you're probably familiar to where the hospital is, but just to give you a bit of a look, we are standing on Silver Hill. To your right is Little Bay. To your left is Lookout. The airport's in front of you, and just behind the airport is where Glendon Hospital is. So the hospital is going to be built exactly in the same site as the current hospital. So this is the hospital that you know at the moment. Just for reference, so this is the road that comes down from Little Bay towards Lookout. This is the accident, the wards building, the pharmacy and the lab, the roundabout with the cherry tree, the operating theater, the mortuary, Margetson, and then administration building, pharmacy stores, kitchen, and the physiotherapy building towards the back of the site. So over the next few months, there's going to be quite a lot of changes at the hospital site. Margetson works have started. All these buildings back here, the services that are there are going to be moved to Margetson. And what that will ensure is that we can clear the space to build a new hospital. And this is what it will look at the end. So the wards building remains, as well as the operating theatre building and the mortuary. The Margetson House remains, so all these buildings at the front of the site will stay there. The cherry tree will remain just there. That was always our starting point. And the new hospital building is located roughly as if you were at the back of the pharmacy looking to the administration building. That's where that is. So, principles of design. We had to make sure that all the services were kept under one roof. We didn't want staff or patients to have to walk outdoors. So everything is in one building. You will move always covered, protected from rain, sunshine, and so on. It's an inclusive space and accessible for everyone. It's adaptable for future provision. It follows the UK NHS guidance, as well as Pan-American Healthcare Organization guidance. And it's building on 2 or 3 floors, depending on the side of the site. It takes advantage of the terrain. The theatre, the labs, the birthing areas, and imaging that have more clinical demands are all grouped together. And then the ancillary services, the kitchen, the laundry, are on the lower floors. There's quality green outdoor space with seating and a cafe. And now let's have a look at the building. So this is the model you can see downstairs. The main entrance is at the front of the site, facing the road, but slightly recessed, so there's parking ahead. Towards your right, there's a dedicated ambulance entrance. And towards your left, along a public colonnade, there's the pharmacy. For reference, this building at the front here is the wards building. So this is the model, as you can see downstairs. It's actually open. You can see the first floor. And I think after this presentation, you will have a better sense of what each of those rooms are when you look down there. So this is a brief organization of the building. So on the right-hand side, when you look from the front of the hospital, so that's the east wing facing Lookout. It's the more public spaces on the ground floor, the reception and outpatients department, accident and emergency. On the first floor is the wards. There's a colonnade with administration and public spaces, and towards the left, the other wing facing west, it's the operating theatre and the lab on the first floor, the pharmacy, the kitchen, and the sterilizing department on the ground, and stores, laundry, and mortuary on the lower ground. Now, this is how the hospital is going to look like. You probably have seen some of these boards downstairs. So this is the cherry tree for your reference, the wards building just behind it, and that's the entrance of the hospital with the car park in front and the accessible parking base closer to the entrance. I'm not sure if you can see very well on this image. There's some detail on the facade that the name is not the final name, don't worry. But also there's a detail on the facade you see quite well on the model is the profile of Montserrat. You will see it better in the model. So this is your main entrance. You can have a glimpse on the right of where the ambulance entrance is. And towards your left, you see the colonnade that goes to the pharmacy. We are now going to come down and go along that colonnade for a little while. There we go. So main entrance, the passageway to get to the colonnade. And here we are. So just on my right, behind me, it's the cafe. On my right here is the conference room. So this conference room is open to 2 sides, to this side on the colonnade, and you can have a very tiny glimpse just there that there's something behind. That's the courtyard. We'll come to it in a moment. Down the colonnade, you will get to the pharmacy. So we are now next to the pharmacy here, and you can see the mortuary building just outside. So you have a public window on the colonnade to get service on the pharmacy, and also internal space for the hospital staff. Along the colonnade, there's some seating area, and there's also shutters, so in case of hurricanes or storms, that can be closed and keep the hospital safe. So we are now across into the courtyard in the middle of the hospital. When you look at the model, you will see it's the internal space between the two buildings. For reference up there, it gives you a sense of where we are. So this is a flat green area that public, patients, and staff can use. The cafe is just there, as well as the conference center. And through this door, you can get a lift to go upstairs to the wards. Now, we are back outside the hospital building, and we're going to go around on a counterclockwise way. So we can see just down here the ambulance entrance for accident and emergency. So there's a dedicated entrance. Accident and emergency department is just down there. Upstairs, it's the wards. So we continue around the building as an area that probably most of you may not see once this is built, but it's all the service areas. So there is actually a ramp that comes from the first floor down to the ground. What this allows is for evacuation in case of emergency of all the patients that are in the wards. So if needed, the ramp can be used for evacuation, so it makes it much easier. On the building on the right, it's most of the staff areas, labs, theater, sterilizing department, and so on, so we only have stairs for evacuation. These buildings connect at both levels, at all levels, so you can always go across, if needed, on a step-free way. So continue going around the building. We are now at the northwest corner. So my back is towards the airport, and this is where the mortuary will be located. Also, along this area, there's a service loading dock for all the deliveries that the hospital requires. And down here, we have the laundry, the stores, and the main entrance for goods and services. So this platform is because the terrain is inclined and the platform is flat, it allows the different height vehicles to make deliveries, inclusive having a step-free area. So we are not now coming back up to the front of the site. You can see here just the end of the mortuary and the wards building, and the pharmacy is on this corner. So, inside the building. So there were some changes that allowed us to get to where we are now along the process. So the hospital has been upgraded to be fully air-conditioned and mechanically ventilated. We are keeping the existing wards building. We created 4 dedicated isolation wards, isolation rooms. This means they have their own dedicated ventilation system, so if there are any sort of diseases that are airborne, they can be isolated in there very easily and safe for everyone. We created an extension to the accident and emergency department. We now have not 1 but 2 resuscitation rooms and a dedicated waiting room. There's an extension to the operating theater department to be bigger, to allow for everything that's required in it. We have upgraded the medical gases system, so everything is now piped and serviced directly to the bed heads. And generally, there's been an uplift of the specifications across the scheme. This means better quality finishes and better equipment. To ensure that all of these could be achieved, we had to create some other additional items. So there's a new water tank being provided to the hospital, a new oxygen generator plant, and also 2 new electrical generators are going to be built at the DMCA site, and these will ensure that the CT scanner runs properly. So very briefly running you through inside the building. At the lower level, we have plant rooms, so that's where the pipe gases are stored and also where the hot water plant is. On the west building, we have facilities for staff. We have the general stores, the laundry department, and the mortuary. On the ground floor, which is the main entrance floor, we have the main entrance. To your right, you have the dedicated accident and emergency waiting area. There's the triage rooms, 2 resuscitation rooms, minor procedures theater with 4 day beds adjacent to it. All the imaging suite are here, the CT scanner, the X-ray machine, the mammogram, the ultrasounds, they're all here. There's outpatient department room, the pharmacy with the service to the public. Behind the pharmacy, there's the kitchen and the sterilizing. The floor above, so above the main entrance, we have the wards. We have a mix of 4-bed wards and individual rooms. We have the birthing suite. We have the administration department for the hospital. We have the theater that takes very large space of the site of the hospital, but very important, obviously, and the laboratory. So the floor above, we have another plant room area. That's where all the air conditioning machines are. And above that, we have the roof that you can barely see. So all the services provided at the hospital: accident and emergency, diagnostic imaging, operating theater and minor surgery, including endoscopy services, general inpatient medical services, maternity, outpatients department, the lab, pharmacy, dietary, mortuary, and the electronic health information system, which is already being rolled out. So looking at how the hospital is going to look inside, when you enter the hospital, this is the first image you see. You have a reception desk where you arrive that will guide you either to the waiting area behind or to the accident and emergency on your right. After the waiting area, that's actually divided in 3 small waiting spaces with capacity for around 50 people. Behind that is how you would get to the outpatients department. So you may or not be familiar with the existing hospital. This is a photo of the wards taken a few days ago. That's how the wards look at the moment in the existing building. We are looking at something slightly different. So it's a dedicated building. That's definitely the main difference. So we have a spacious corridor. We have a nurse station at the center of the wards department. The nurses station overlook 2 high dependency bays, each bay with 4 beds. Behind the nurses station, there's a intensive care room for babies. There's the nurse's office, and further down the corridor, there are individual rooms with secondary nurses station. So looking at how one of these wards would look like, so you can see that they feel a bit more spacious than the existing ones. This is because we are following the latest NHS guidance. This provides more space around the beds. You can have privacy through a curtain, and you can also have more space for any services that need to be done to the patient in private. This is the birthing suite. So it's a dedicated room. It has a birthing pool. It has a bed. It has all the services required. The bed head, there's actually 2 bed head services, so all the piped gases and so on. And just behind me on the left, where the mom's getting ready to go home, it's a bathroom with bathtub, shower, bidet, toilet, everything. So at the entrance of all the clinical rooms, there's always a wash and basin to ensure that hygiene can be kept across the site, and quite often you will find curtains to ensure privacy of the patients. This is your current accident in the emergency room in the hospital. This is how the new accident in the emergency, specifically the resuscitation rooms, are going to look like. So they are substantially larger. There's 2 of them, one on each side of the ambulance entrance. You can see the ambulance just outside the window there. So if, in case this is required, the ambulance arrives, the patients come directly into these rooms. They are much bigger. You can have all the staff around the patients safely with all the equipment necessary. And then from here, an assessment will be made on the next steps. So on this floor, which is the ground floor, you have the CT scanner. You probably have seen some works going on around the site. So that's actually a construction for this very specific model that's in the image. But further down the line, it will have its own dedicated room in the hospital. And if you happen to work as an imaging specialist, this is your office. So the current theater, it's this one. It's a large room, but there's quite a large number of equipment that has to be stored in here at the moment. So the new theater is probably around the same size, but there are adjacent rooms to keep all the equipment that's not being used. So there's more space for doctors, nurses, staff to move around. And also, you can see here there are 2 screens. These allow for telemedicine, both for teaching, but also to consult with specialists that are not in Montserrat. Probably parts of the hospital that if you don't work there, you may not be familiar with. This is the existing laboratory, a little bit tight, and I'm going to just point at this machine here called the Architect. So in the new lab, the Architect is that machine you see behind the lab technician just there. So what we are doing is we're bringing the 2 labs that are currently on site to one space. There's a central working area, and then there are adjacent labs on the side for specialist testing. The existing administration building, again, photos from just a few days ago. There's this space that has 3 desks, and then there are individual offices. We are still continuing to provide a reception area that has 3 desks, a waiting area as well. And then further down the corridor, there will be dedicated individual offices that look like this. And last but not the least, some of the services that are essential to the running of the hospital as well. The laundry, we went on a laundry day, as you can tell, everything's hanging to dry. The laundry at the moment is one single room with all the steps in the same room, and then an ironing area outside. The laundry that we are proposing is a series of 5 different rooms to ensure that you separate from the dirtier to the cleaner items. And we are now on the drying area, so after the pass-through washing machines, you take the clean laundry on the side that we are standing here. They can go directly to the dryer, so they can go outside to dry. There's also this pass-through iron that will ensure that big bed sheets can be ironed quickly. So the question you've probably all been asking for. So the tender for construction is coming out in a few weeks to pre-qualified contractors already. So the quarters you see here are the calendar quarters, not the financial ones. So in the first quarter of next year. Margetson, due to start in the first quarter of next year, it's slightly ahead of schedule because it started today on site. And what Margetson does is once the refurbishment is done, the lab, the kitchen, the laundry can move into there to allow for the construction of the main building to start. And that's scheduled for the second quarter of the next year. A couple of years later, the construction should be completed, and then on the third quarter of 2026, the hospital should be opening. There's always this period of time that's essential to ensure that everything is commissioned, tested, that all the equipment is functioning before actually being able to open to the public. So thank you very much for your time, and let us know if you have any questions.
So good afternoon, good evening, everybody. Thank you so much for getting us to this phase. And I have to start by saying thank you for keeping the cherry tree, because I went to St. John's Primary School, so that was an important part of the primary school for us, especially in the village. So I'm so happy that you've kept that. So one of the things that you mentioned in your presentation was that it's built for hurricanes. Can you just elaborate a little bit on some of the things that you've put in place for natural disasters, because we're so susceptible to them?
Yeah, so all the engineering of the building is done using the Caribbean codes. We actually also consulted with a Caribbean specialist. The construction is concrete frame and blockwork, which is a construction that is common in the Caribbean, so it's not any new technologies, anything that is difficult to maintain, let's put it like this. That would ensure that in terms of earthquakes, the building is resilient. For hurricane, we have shutters across all the windows. You may have seen in quite a few of the visuals. You can even see here, and you will see in the model, there are shutters on every window. So the shutters will provide you shading when they are open, and in case of hurricane, they can be lowered. We expect the shutters not to be completely opaque, so you can still have some natural light inside. But the perforations will be small enough that obviously there won't be anything flying. In terms of landscaping around the hospital, we are not keeping any tall trees. The cherry tree is staying because it's very important, but we are not putting, I know the model has some palm trees. We are not putting palm trees. I think there was a little bit of creative flair from the model maker. We keep the planting low to ensure that you don't have any big elements flying around the hospital that could damage it. There's also measures in place for, so there's a water tank that ensures water supply for a period of time if the hospital loses the main water supply. There's two backup generators, not one, there's actually two. So all those measures will ensure that the building is resilient.
Okay, so my next question before you sit down is, how does the architectural plan account for future expansions or technological advancements in healthcare, ensuring that the hospital is adaptable over time?
In terms of physical space, the site has its limitations. As you know, it's the hospital site. What the hospital has in terms of flexibility is the rooms have flexibility to change functions. Okay. So to give you an example, the administration area that's inside the hospital could easily be moved out of the hospital to allow for an expansion inside the same building. There are buildings that are remaining on site as well, that what will be done with them, that's a separate decision and discussion to have later. But there is space and flexibility to allow for this.
Okay. So my next question is, how many beds will the new hospital have, and how did Article 25 and the government decide on this number to meet the healthcare needs of our community?
Do you want me to continue replying?
Can you just repeat the question?
So the question was, how many beds will the new National Hospital have, and how did Article 25 and the Government of Montserrat decide on this number to meet the healthcare needs of our community?
Okay, so let me take it a little bit back. Prior to 2018, the Government of Montserrat and it would have been DFID then, would have commissioned a study just to determine just that. At that time, the recommendation was for a 20-bed hospital. They took into consideration population size as well as basic broad parameters. We were able, through negotiation, to have an agreement where we were able to increase the capacity from 20. So we went from 20, and we always said, if you look back at the hospital brief, 24-bedded facility with expansion capability to 31. So yes, it is showing a 25-bedded facility, but it also has, for example, another room for like persons who are mentally ill. So we have that secure room, that's 26. We also have 4 day beds adjacent to the minor theater. So the hospital does have the capability to expand to 31, and as Branko would have said, additional capability throughout the building depending on what is happening. We have outpatient rooms in accident and emergency. Also, you have the flexibility to convert admin rooms in the future if the demand is there for that.
We've passed the design phase. How much will it cost to construct the hospital, and what factors influenced your cost estimation?
I'll leave that for...
So I'm Hannes de Bruin, I'm the project manager. I think that you're probably aware that at this stage, we're about to tender the construction out. So at this point, it is not logical for us then to say what the hospital is going to cost. We will be able to tell you in the second quarter of next year, once we've had the bids in, we will then be clear exactly what the hospital is going to cost. We have had estimates from quantity surveyors, but no, that's not something we can announce in public at this stage until we've had those bids in.
Okay. And are you requiring the people who propose to construct the hospital to ensure that it's also cost effective as well as maintaining the high quality of healthcare and infrastructure?
Absolutely, that's been a key part of the design throughout. So it's not just a matter of designing the hospital so that it's got everything, but it's also designed in such a way that it's cost effective to run. So as an example, it has air cooling throughout. But if you think about that, in a standard building, that potentially is going to cost you quite a bit to maintain. So to counteract that, this hospital is going to be fully insulated. So every single wall on the outside is going to have a covering, including the roof. So that is going to actually contain the cool air within the building, and it'll keep the heat out. So we've done things like that throughout. We've also equipped the building, I say we have, the design equips the building so that it's ready for solar panels. So at any point we think that solar panels are the way to go, the building's equipped. It's simply a matter of plug and play and off we go. So it's all of these little things that we've focused on to make sure that maintenance is as minimal as possible.
Okay, thank you very much.
Sure. Show you again. Can show you again. The picture of the ward. The picture of the ward. So maybe I'll ask Brankett take us through to that. That was something that was very clear in the remit, was that we wanted a space for children because the experience has not always been great in the past. If you look at this room here, this one doesn't actually have a door and it's right by the nurse's station, but the room next to it looks pretty much the same and it will have a closed door, so it's fully secure for children and only people who are allowed in and out can. And so obviously that then can be decorated so that it is comfortable and inviting for children. So yeah, we have definitely thought about that.
Thank you.
I'm going to hand over to Branka.
I also want to add that there are individual rooms that are big enough to accommodate the patient's bed. So if the patient is a child, there is space for family to stay with them, a parent, an older sibling, a relative to stay with the child in the room. So that can also be used for children. So it doesn't need to be like that.
Thank you.
With their own bathroom.
Take the opportunity. Good night. Good presentation. It's good to see the information is out. I commend the team, as it is important to get information out so that there is no voids, because when there's a void for information and lack of information, it will be filled with a lot of negativity and you'll be constantly fighting fires to get your message across. So I commend you on this and I look forward to more aspects like this. The question I would ask is a very simple one, just for my knowledge. For the A&E section, what is the capacity that we're looking at for the new hospital? The maximum capacity A&E. The current capacity, I think is 2, if I remember correctly. So I'm trying to remember what's the capacity now for the A&E, casualty, accident, and emergency, however we want to term it, in terms of, let's broaden it to a mass casualty situation. Let me put it along those lines, so we know what is actually the capacity for that section.
Hello. So the capacity is, as you can see on the plan here, we have, at the bottom of the page, we have a dedicated accident emergency waiting room here. There's an initial triage room after that, so that's 1. We then have 3 dedicated assessment bays, so we get to 4. And then either side of the ambulance entrance here, you have 2 more, so it's 6. So the resuscitation rooms there are the ones you saw in the visuals earlier today. And yes, and the acute mental health room, which is another one on the first floor, which could be used in that circumstance, depending on the need.
Thank you.
Thank you.
Do we have any other questions?
Everyone,
Good evening.
a pleasure indeed, and a very good presentation. Everybody registered. So when the building is ready, on that morning, Mrs. Gerald and Dr. Greenaway said, all of our staff are registered as healthcare professionals to work in this new facility.
Yes, so we are, it's on the list. But remember, our team, we're small, and we have to follow government systems and processes, right? So the regulatory framework for that is actually different from the hospital process. So we're talking about something different. That's an actual law.
It is indeed, yes,
Right.
it is. But,
So just to say that, yes, it is on the list of things that we want to implement,
Yes.
but there is a process to that.
Correct.
So we are hoping that it can meet the opening of the
It
new
will-
hospital. Yes, it would be wonderful, right? But again, we are, it's not to say that, you know, that's not something that we can do in 6 months. That's going to take a very long time to do, and we have to be realistic, right? So again, as I said, it's on one of the list of things that we want to do. And we're hoping that we will get there by 2026.
Yeah, I think my proposal, Dr. Greenaway and Mrs. Gerald, is that you set up alongside the construction, the time that construction starts, you start that process of getting people registered. So that law is yes, but the law can be, I think that they have to understand that this hospital, when it opens, has to open with people who are licensed to practice. This is what we need to do in Montserrat.
I agree with you. Again, we have to follow the processes that exist in the Government of Montserrat.
Yes, absolutely.
And as I said, it's already on the list of laws that we want to implement, but it has to go through the process.
Understood.
The system. But again, that is separate. It is a separate process to this hospital build, right? And it will not prevent us from opening, for sure. But we are working on it. And all the things that you spoke about as well, in terms of speaking about quality, safety officers, a quality board, all of that discussion has already begun, right? But those are softer elements of the new hospital project. That is why we have a health transformation project manager. That person or that role is responsible for having the discussions on these things and mapping out the pathway to attain these different things. So it's not that the conversation has not been had, we've had the discussions, it's just that with our team, we have to tackle things in a logical and systematic manner, right?
Okay. But I think it goes back to how you offer the service, because if I have insurance and I come to the new hospital, my insurance says to me, well, who's going to do your CT scan? Who is your nurse? When was the last time she did her BLS? Those things, the insurance can refuse to pay for the service that you've offered with this new hospital. So we need to get things. It's going to take a while, and I understand, but we have to look at how we're going to get revenue, because revenue will come from the visitors who have really good insurance. You can charge them 3 times the amount, but they won't pay. They won't pay.
and that too is a separate discussion.
Yeah.
So health financing, which is what you're leading into, is also something that we're working on.
Yeah.
So there are several project streams going on at the same time. Yes. Right, and they all interlink with each other, and we are hoping that they will eventually converge, but again, we're going to be realistic. Again, that is a separate discussion.
Correct, yeah.
This is basically about the hospital build, so I won't really go into detail about those discussions in this forum.
Okay, no, that's fine. Yeah, question answered. Thanks.
Getting back to the waste treatment, is the waste system basically all inclusive, or some of this will be handed over to the environmental health who deals with the national waste system?
Hello. So the simple answer is it's all inclusive. So it's all controlled on site, and then any runoff after that point, once it's been processed and the new RBC goes into the leach field on the side of the site. So it's all dealt with on hospital grounds. Oh, waste. Oh, not wastewater. Solid waste, yes. Sorry. So all the waste, as in products coming out of the hospital, will be stored on the edge of the site in the building at the top of the screen, which is the small rectangle at the top. That will then be picked up as part of the normal operations in Montserrat from there, and then taken to the, what's it called, a dump by looking up. And of course, the medical waste will be dealt with in the incinerator on site. So nothing bad coming out of the hospital will go into the dump. It will be dealt with there, and then when processed, passed on. Sorry, answer that in a roundabout way.
No, well, if you're speaking of only medical waste within the compound, that is being catered for.
Yes.
Well, some of the
That's right.
I can't imagine that you will be covering all the waste coming from the building, and the waste that comes from the building, although you may make provisions for medical waste in certain places, inevitably some of that waste goes outside of where the normal provisions are made, and if that is being handed off to the well, it's the utility that deals with the waste. Is the national waste system sort of built to handle any of the spill-off? If there any provisions are being made for that.
Okay, so if I understand your question correctly, you're saying that if medical waste is not disposed of in the way that it should?
Yes.
Well, according to infection prevention and control procedures, in our hospital, waste is disposed of in a particular way. And the bags are color-coded, and so there are specific areas where you're supposed to get rid of waste. The waste is separated at the source of where the waste is produced. So medical waste is treated, so it's burned in the incinerator, and then the remains from that can be sent to the national dump site. In terms of you're asking about seepage of medical waste outside of that, that doesn't usually happen. So I'm trying to understand your question better.
Well, what I'm saying is that it's fine that the majority of the waste is taken care of based on whatever system is in place.
Mm-hmm.
But I would think that you make provisions for the normal activity or whatever, but there always some accident or otherwise where some of that medical waste gets into the regular waste disposal systems. And I think we also have the clinics around that sometimes may have accidents as well. What I'm asking is if the Ministry of Education, perhaps, I don't know if they're the ones who will be responsible for that. I don't think maybe the architects of this is responsible for what happens outside. But what I'm asking is if any provisions are being made with the construction of this for the possibility that some of that does happen and the disposal on a national basis. If something happens and it is not contained within the hospital, what happens?
I'm sorry, I still don't understand the question.
You're still not following me?
No, because even in the clinics, as I said, we have color-coded bags as well as, so let's say for an example, a needle, right? A nurse or a doctor is taking blood from you, it's disposed of in those little red bins. I don't know if you've ever seen. So health professionals, they don't throw needles in regular waste.
Is it foolproof?
Is what foolproof?
That's basically all I'm asking.
Well, nothing is foolproof, actually, right? So we have protocols, and they follow them. In terms of at the dump site, I would prefer if the environmental health personnel, if they would answer that question, because of how they treat the waste on that site. That is slightly out of my expertise to answer your question. But again, we're here to discuss the hospital build and the architecture, the way how it has been designed We have waste disposal sites in every room. And then there is the waste treatment site in the image that they're showing there. Oh, well. Which is a system we have now. Right. We also have that currently.
Well, I just want to know if something was built in with the whole project to ensure that, you know, what normally happens is that something happened in isolation here. And no provisions are made in the event that what you're doing here happens to impact on there.
Oh, okay.
It's not particularly for the architects of the hospital. I wanted to know if what was being done in terms of the hospital itself, if it was all inclusive with respect to the medical waste, that there isn't any provision for some of it to be handed off. Now, based on what I'm hearing is that you've made provisions within the hospital for what the hospital should generate. Right. And I am only asking further that whether or not the health department is looking into the possibilities that may exist if something happens and your protocols are breached.
I still don't understand the question. Okay, is your question for me?
Might be for anyone. The young lady asked about the pediatric ward, and I saw the mother-baby wing. But one thing that I didn't see was a NICU, or maybe I missed it.
There is a special care nursery.
Okay.
Yeah. Yeah.
Is that located within the pediatric unit?
So let me explain. So there is no dedicated pediatric unit, right? So what we have decided, so there are a number of private rooms. There is a section towards the lower end that we are dedicating to pediatric patients. They're self-contained, they're large enough, like what Branka explained, so that you can have a day bed, they have self-contained, has its own bathroom, etc. And the plan is we can make it more comfortable for children with murals or different furniture that would be appeasing to that particular population.
So if you had a baby that required that, your room can adapt to that. Is that what you're saying?
Yes.
Okay. So the 25 beds will cover NICU, peds, the adult, and an adult ICU if need be.
If need be.
Okay.
And obstetrics and gynecology.
Okay.
Yeah, there's a special care nursery, so there's actually a dedicated room for that. For newborn. Yes. Yes. Yeah. Yeah, and it's actually not counted in the. It's not counted in the 25. It's not a. Yeah.
Yes, I'm just wondering, I know we're following UK rules and PAHO rules, but I'm just wondering if everything has to be air-conditioned. It looks like everything is closed up, with windows closed up, whereas that site is a very airy, pleasant site, you know. So I'm wondering if just some, maybe the infectious ward certainly should be enclosed, but whether the whole lot of everything should be.
So this was a decision that was taken by the hospital team. And in the long term, there are reasons for that. The windows must open. It's a requirement of local codes. So if needed, the windows can be open. In addition to the air condition, there's something called mechanical ventilation, which is something that is less common when you put air conditions in a building after the building is built. So what mechanical ventilation does is it ensures that fresh air is brought into the room and the air inside the room is taken out. So you don't have the same air circulating. In terms of the infection control, we actually have 4 dedicated isolation rooms that each of them has their own air condition and ventilation unit exactly to prevent infection from one room to the next. Also, each department has their own ventilation systems because of that, to ensure that there's no circulation of air between, I don't know, the theater and sterilizing, or the laundry and the kitchen. They have their own ventilation systems.
One thing, what are the windows made of then, if they can open? Are they aluminium or?
So, yeah, they're aluminium and glass, double glazed. Also, if there's things like ashfall, the ventilation system would allow you to still have filtered air coming through, which in natural ventilation would be very difficult to achieve.
And the design, can we just have a look at where it is? Again, if you don't mind, I just want to ask 2 questions with regards to the look, the way it's, in terms of where it is, what's around it. Yeah. Not the actual.
I'll point you. Where
Okay. Yeah, yeah.
So, for reference, your main entrance is here. The CT scanner is back there on that corner.
Okay.
So it's this room here. So on 2 walls, it's to the outside. These are solid concrete walls.
That's my question. That's what I'm asking for. Yeah. Okay. As you get in, you're coming into the room itself. What's adjacent to it?
Adjacent to the room, to the left of the entrance, is the control room.
Okay. On the other side?
And on the other side to the right, so there's a wall that obviously will need to have additional protection, like the whole room has to have.
Absolutely. Yeah, absolutely.
And just outside that wall are so it's an open area with day beds.
That was my next question.
For observation of patients.
That was my, because you didn't mention it before, and I just realized you didn't say it when you were going through, because the prep for CT requires some sort of like an area, like a day bed area for prep, for cannulation, patients, because you're going to have a 64-slide CT, I think. So you're going to be doing some, really contrast studies, so they need to have somewhere. So that's where they're going to be.
It's just outside here.
Just here, just there. Okay. And the wall separating that area?
Capsule. Capsule.
Okay.
Capsule.
Okay.
Capsule.
Okay. 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 Yeah, I didn't see. You didn't mention this as we was going through the pictures. That's why I was wondering where it was.
These are outside.
Okay.
Outside.
Outside.
The
yes.
CT scanner room.
Thanks.
The hospital is located very close to the airport. Have you considered noise pollution in the design, or how that will affect the medical care of patients with all the noise from the aircraft?
No, it's okay. So, yes, we have. So, as you see on the plan here, the airport is above the west wing, and the patient area of the hospital is in the east wing. So, we are generally shielding it with the staff areas, so the patients are protected. Oh, you have to go through a second. So you can see, yeah, the wards building on the bottom of the page, which is the larger of the 2 wings, is protected effectively from the airport by that west wing. Also, we have the double glazed windows and the ventilation system so the windows can remain closed and still have fresh air without needing to open them from the airport.
So just a general comment really is that once this building has been built, it is going to be the safest building in Montserrat. So any other disaster that you have, this building is not going anywhere. It's not blowing down, it's not falling over. It's going to be very secure. And I think it will factor strongly in any future national disaster plan. Because it is so well catered. You know, so for example, if there was a hurricane, anything like that, it has facilities for the staff to be able to stay overnight. So just things like that, you know, all of these things are based on the information that you as an island have actually fed through over the years, including the staff. So it really is very well designed to cater for just about anything that Montserrat and the Caribbean can throw at it.
Well, I assume that we are now at the stage where you have exhausted all of the questions, and I am very thankful and really appreciative of the fact that you came out tonight and that you asked questions. I'm glad for this opportunity. Just like you, we are all very excited about the new National Hospital. And I would tell my team members I can't wait to put on my hard hat on the day when the excavator is there and the contractor has signed. So for now, we recognize that we have to carry on going through all the various steps. And of course, if you want to build something, you have to make sure that the foundation is right. We don't want to be building something that is not representative of us and that is not representative of our needs and going forward. So again, I want to thank you for attending the session. We would have recognized that we would have had this a little late, so we have also provided some refreshments for you downstairs, and you're also free to look at the model that is there. Lucky for you, this model should have arrived more than a week ago, and it arrived just in time so that you can see it. So as you're leaving, please take the time to look, and I look forward to the day when we will all be standing. Hopefully we will all be alive in 2026 when we are going to that ribbon cutting ceremony. I'm hopeful that you will be there, Ms. Charles. Yes. All right. Have a very good night. Thank you.